The addition of local regional hyperthermia in recurrent head and neck cancers given chemoradiation as salvage treatment. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years. There was a paper published in February of 2025 from Taiwan where they were investigating the addition of local regional hyperthermia, a heating machine, in patients who've already had been irradiated to an area more localized in head and neck cancers. And they were reapplying chemoradiation, beginning with a radiation boost. And there was a phase 2 trial. And what they noticed was that there was noteworthy responses and important overall survival that looked quite encouraging. So in particular, the study mentions they demonstrated, I'm just reading this, impressive efficacy by incorporating hyperthermia into salvage chemoradiation, achieving an average survival of just under 33 months and a year overall survival of 80%. So, and what I find really interesting is that, this was done in their, when you're looking at the author information, it was done by their Department of Radiation Oncology. And so the use of hyperthermia technology is not new. So in this study, they actually use a device called the Thermatron from Japan that's actually approved in Japan. We've been using local regional hyperthermia technology for over 10 years. We have a similar related device and that we've been using as well. And I think what the general public doesn't know is that the use of heat could be potentially used to try to enhance the effects of radiation, to help in engaging the immune system, to allow potentially a greater perfusion of drugs, say chemotherapy, into target areas. So some of the earlier indications of the use of local regional hyperthermia was for already radiated areas. So in head and neck cancers, in radiated breast areas, where generally when you start to try to re-radiate again, it doesn't tend to work as well. So again, it's really nice to see this research out of Taiwan, where they were being creative with some radiation and applying the hyperthermia technology that they felt was a valuable addition. So in the study, they were giving it weekly for 6 weeks. And while the patients were receiving radiation, they say got radiated, and then within 2 hours they received the hyperthermia. So encouraging study, and so tends to validate some of our, I guess, clinical observations in practice. And I thought it was important to share.